Hello, back for more, eh? Well, I've got more. The skull anatomy just keeps on giving, and that's kind of like the bare bones of head and neck anatomy. All right, this week, so in previous weeks, we've looked at the bones of the skull, we've looked at the sutures that join the bones of the skull. Now, there's something else that's very important about the bones of the skull is they have holes in them. Sometimes they're big holes like this, and sometimes they're little holes like this. And this is what we'll be doing. We'll be using skulls and pipe cleaners and looking at the foramina. A foramen is a hole in a bone. If there's a hole in a bone, it either used to be a joint or something passes through it, which is more likely. And if it makes a bony tube, it's a canal. So we will look at the foramina and the canals, largely of the base of the skull, like going from the skull out, because there are more in the face, but we'll be here all day if we try and do all of them. So we'll focus on these first. Why do I need to know all this? Well, I think you'll agree with me that what's in here is kind of important. The rest of this just supports this, right? The stuff in there, this is just like supportive apparatus. It's the bit in there that counts. And the bit in here communicates with the stuff outside, as in it sends blood vessels out, blood vessels go in, nerves go out, nerves go in through the bones of the cranial cavity. The bones are supporting the brain, and they have to have holes in them for those things to come in and out. So the functions then, so if you have somebody that's had trauma or pathology inside the cranial cavity, and you understand the blood vessels that supply those tissues, where they run, then you can think about potential leaks of blood, hematoma inside here. You can think about emboli, like blood clots, things that block arteries. You can think about where that's gone. Nerves, cranial, so the cranial nerves are nerves that come out of the brain and brainstem, pass out through these foramina and onto different places, mostly in the head, but some travel all the way down to the abdomen and so on. If you have somebody that, when they poke their tongue out, it pokes to one side, or they have double vision, or they don't have a pupillary light reflex, or they've lost control in some of the muscles of facial expression, or they've lost sensation from the skin of the face, or they have pain in the skin of the face, or they've lost their corneal reflex, or many things that you might identify in somebody else. If you know where the cranial nerve comes from out of the brainstem, how it leaves the skull, and then what its function is, that's it. You've just described the root of that cranial nerve. You can then use all of that information to work out what's going on in your patient. So this is really, really useful anatomy. It's not there for the sake of it. It's a piece of the puzzle. So we'll start up here, we'll work our way that away, and we'll look at each foramen and talk about what goes through it, and maybe what it does. I'm going to talk too much, aren't I? Alright, so you see what I've done. I've taken the skull cap off. This is anterior, and we're looking here. What we see here is, instead of like one hole, we see lots of little diddy holes. And this is the cribriform plate. This is in the ethmoid bone, this very central bone that forms the upper part of the nasal cavity. It's quite a tricky one to get to grips with. And the cribriform plate has lots of little holes running through there because cranial nerve 1, the olfactory nerve, runs anteriorly from the brain and has an olfactory bulb, one on either side, that sits in here and then sends nerves down through into the nasal cavity, and that's how we detect smell. This is actually a nerve that if you damage it, it grows back quite well. I think it's because those little nerves aren't very long and they've got bony canals to direct their growth and so on and so on. So cribriform plate and the olfactory nerve, cranial nerve 1. Okay, so we're still anterior here. The orbit is here, right? So if we continue a little bit this way, there is now a canal there. So if I pass the pipe cleaner in, it comes out in here. So that's a bony tube. That is the optic canal. And through there passes the optic nerve, cranial nerve 2. The role of the optic nerve is to carry sensory information back from the retina. So this is detecting light and taking it back to the brain. Now, this depression here is the sella turcica, this Turkish saddle, and in there sits the pituitary gland, kind of like a central hormone controller structure. And the optic nerves from left and right will cross over here. It's more complicated than that, but essentially they cross over here, and look where that is now. The pipe cleaner is superior to the pituitary gland, which means tumours of the pituitary gland can push up into the optic nerve and cause visual disturbances. And then really the ophthalmic artery is the other big one, because the ophthalmic artery is, we'll see the internal carotid artery a little bit later here, and the ophthalmic artery is a branch from that passes into the orbit and then supplies blood to all the structures in here. Very, very important. So, optic canal. Oh, we can see. So, in the orbit, there is a fissure. So, this is a slit. All right? You can see the light passing through it there. That's the superior orbital fissure. And the superior orbital fissure is a big hole. It's a big slit, right? And the superior orbital fissure is separate to the optic canal. Through here pass a whole bunch of blood vessels and nerves. Cranial nerves 3, 4, 5, well, part 5, and 6 pass through here. Cranial nerve 3 is the oculomotor nerve, so that's going to innervate the muscles, the extraocular muscles that move the eye, most of them, and the muscles inside the eye as well. And cranial nerve 4, the trochlear nerve, is going to innervate one of the muscles, the superior oblique muscle. Cranial nerve 6, the abducens nerve, is going to innervate one of the extraocular muscles, the lateral rectus muscle. But superior orbital fissure, think cranial nerves 3, 4, 5 and 6. So cranial nerve 5 is the trigeminal nerve. It's the major sensory nerve from the skin of the face, and it innervates the muscles of mastication down here as well. It sends its first branch, the ophthalmic branch, through here, which is why I say part 5 goes through there. So the superior orbital fissure. You can see there's an inferior orbital fissure as well. That connects with the deep face, so that's for a different week. We're just looking at holes that go between the cranial cavity and outside. Okay, so if the pipe cleaner there is going through the superior orbital fissure, and that's anterior, if I tilt this, you can just about see that next to it is a nice round hole that's going not to the orbit. It's a little bit more inferior. This is foramen rotundum. Nice round hole, see? Foramen rotundum. If I turn the skull round, oh, where's the pipe cleaner? Well, it's deep in here. So it's deep in the maxilla. Just see it in there, right? Wiggle, wiggle, wiggle. So the maxillary branch of the trigeminal nerve, the sensory branch to this part of the face here, like to the upper teeth, that sort of thing, that's passing through the foramen rotundum. That's letting it get to the maxillary region of the face, foramen rotundum. And then next to that is a nice oval foramen called foramen ovale. I don't know why students complain about this. It's so straightforward, right? So this oval hole is foramen ovale. You can see how that's leaving the skull there. Turn it around. Where's the pipe cleaner coming out? It's coming out down here. So posterior to the, deep to the mandible. So the mandibular branch of the trigeminal nerve is going to drop down here, and that's going to carry sensory innervation back from the jaw, from the lower teeth, for example, and it's also going to innervate these muscles of mastication, the ones that you chew with. So that's foramen ovale. And then next to foramen ovale is a little diddy hole called foramen spinosum. If I pass the pipe cleaner through there, funnily enough, it comes out in the same place, deep to the mandible. Now what we have here is we have an artery, the artery of the deep face is the maxillary artery, and it gives off a middle meningeal artery which passes through foramen spinosum and up into the cranial cavity. So the middle meningeal artery is going to supply blood to the meninges, so the connective tissue surrounding the brain, and the artery will actually run between the bone and the dura mater. And we can see impressions left in the bone, even though this is a plastic skull made from impressions from other skulls, I imagine. We can see the impressions left in this skull by that blood vessel, because the blood vessels and the bones grow together. If we looked at a real skull, that would be even more prominent. This one's a little bit chunky, a little bit beefed up. It's that middle meningeal artery which is at risk of damage from a blow to the side of the head here. This is a weak spot. The bone is thin. We have the terion of sutures, and then we have the middle meningeal artery which branches on the other side. So foramen spinosum, next to foramen ovale, and through there passes the middle meningeal artery. Okay, now next to that we can see this kind of this ugly hole here, and this is foramen lacerum, and this isn't really a hole. It's a hole now because we've taken away all the cartilage from this skull. It's just bone. Well, it's plastic, but it's plastic bone. You know what I mean. In life, this is a joint between bones here. It's a cartilaginous joint, so that foramen is actually filled with cartilage in life. There might be a few little emissary veins squeezing their way through there, but it's not really a hole you need to worry about. But next to it is a canal. By the way, if you're studying this, this is the way to do it. If you're in the lab, get yourself a skull, get yourself a pipe cleaner. Don't use pens because they leave marks on the skulls. Use pipe cleaners and thread them through, and you can identify stuff. Anyway, so if I pass this pipe cleaner through, that pipe cleaner has passed through the carotid canal. So guess what blood vessel it's mimicking? It is the internal carotid artery. And if I look at the base of the skull, there it is coming out there. So that's where the internal carotid artery enters the skull. So it passes through the carotid canal, and actually this groove here that the pipe cleaner has settled into is a groove made by the internal carotid artery. So all these shapes are made by the artery. So in fact the internal carotid artery is lying upon foramen lacerum. Continuing on around, it gets a little bit difficult to see here, but you remember this bit here, this bit, get my hand in the way, this bit here. So this bit here, this is the petrous part of the temporal bone, this rocky chunky bit of bone, and that has got a canal going into it. But if I put my pipe cleaner in there, it doesn't come out anywhere. And if I do this with a real skull, I have the same problem. My pipe cleaner goes in, doesn't come out anywhere. The purpose of the petrous part of the temporal bone is to hold the apparatus of the inner ear. So the cochlea that is detecting sound and the vestibular apparatus that is detecting head movements and that sort of thing. And those structures are innervated by the vestibulocochlear nerve, cranial nerve 8. So cranial nerve 8 passes through there to those structures. And that explains why my pipe cleaner doesn't go anywhere, because it goes into the inner ear, collects sensory information from those structures, and that's it. But the facial nerve, cranial nerve 7, is an incredibly busy cranial nerve of the face. It passes through there as well, but it branches, and those branches find their way out through various cracks and fissures and other canals and foramen. It's a sneaky little thing. So again, my pipe cleaner, even if it's being the facial nerve, it'll go in here, but it won't find its way out through those cracks and fissures. So cranial nerve 7 and 8 go through here, and this is the internal auditory meatus. Now, if there's an internal auditory meatus, there must be an external auditory meatus. Where is the external auditory meatus. It's your ear hole. It's that there. And again, if I pass my pipe cleaner in there, it doesn't come out anywhere. And that's the same for a real skull. Because there's a tympanic, well, in life there's a tympanic membrane, then you've got the soft tissues of the eustachian tube or auditory tube, which comes out in the pharynx and stuff like that. And I told you I talk too much. Back to the topic at hand. Internal auditory meatus, cranial nerves 7 and 8. If that's the petrous part of the temporal bone, inferiorly we have this big ugly hole. Now remember that the holes in bones, or bones generally, are shaped by things that attach to them or go through them. So if this is a big ugly hole, there's probably multiple structures going through it, causing it to form that shape. Now that is the jugular foramen. Okay, there's a clue. So what blood vessel starts there? See, that's where it comes out there. That is where the internal jugular vein comes from. So we have dural venous sinuses inside the cranial cavity, made from spaces in the dura mater, which collect blood, and they then, most of them will then drain to this point here and drain that blood through the internal jugular vein. Now, although the internal jugular vein is here internally, and we saw the common carotid artery out here, because the carotid canal kind of travels a little way, the opening of the, so like the inferior opening of the carotid canal is right next to the opening of the jugular foramen. And that's what we see in the neck. We see the internal jugular vein, and we see the internal carotid artery, and then the common carotid artery running together down the neck. Now, what do we see running with those blood vessels in the neck? We see cranial nerve 10, the vagus nerve. So the vagus nerve does also pass through the jugular foramen, and then it runs down the neck, and then to the thorax, and then to the abdomen, right? There's some logicalness to this somewhere. But have you been counting? We've actually been counting our cranial nerves. 1, 2, 3, 4, 5, 6, 7, 8. We've missed out cranial nerve 9. So in fact, through the jugular foramen, we see cranial nerve 9, 10, and 11. So that is the glossopharyngeal nerve, cranial nerve 9, the vagus nerve, cranial nerve 10, and the accessory nerve, sometimes known as the spinal accessory nerve, cranial nerve 11. All of those pass through the jugular foramen, which is what gives it its large and ugly shape, that and the internal jugular vein, right? Okay, so then we've got the obvious hole here. This is foramen magnum, the big hole. And through here passes the spinal cord and the brain stem, the spinal cord becoming the brain stem, right? Now watch out for the accessory nerve here, cranial nerve 11, because you'll read that it passes through foramen magnum and it passes through the jugular foramen. Now what's going on here is that it's not like two nerves coming out of two places, but the spinal accessory nerve gets called the spinal accessory nerve because it has a whole bunch of rootlets from which it forms, and some of those come from the brainstem, and some of those come from the spinal cord, which means that the accessory nerve as it forms is going to go up. It's going to run superiorly through foramen magnum and then out inferiorly through the jugular foramen. Does that make sense? Kind of collecting itself and then bloop. So cranial nerve 9, 10, 11. All right, cranial nerve 12. Well, cranial nerve 12 is the hypoglossal nerve. And it's going to go below the tongue. It's going to innervate the tongue. All interesting things really go anteriorly, right, like cranial nerves. So we have another canal here. So what we're looking at here is the occipital condyle. Occipital bone. This is a condyle, as in it's a knuckle. It's articulating with the first vertebra. And through it is a bony tube, a canal. And this is the hypoglossal canal. So The cranial nerves come from the brainstem in descending numerical order. The first two come out of the cerebrum, but other than that, they come out of the brainstem in descending numerical order. So cranial nerve 12 is the last cranial nerve to leave, and then it passes anteriorly through the hypoglossal canal. And look, it's on its way to where the tongue is, down here. Perfect. So the hypoglossal nerve. I'm going to chuck in a bit extra. So there's the whoop. So if we look at the base of the skull, we see those foramina again, because that's where most of them are coming out. But there's an extra one here. That is the mastoid process. That is the styloid process. And between them, we see an opening, another canal. But again, if I pass my pipe cleaner in there, it doesn't come out anywhere. And if I do this with a real skull, I have the same problem. This is the stylomastoid foramen, and out from here appears the facial nerve, and the facial nerve will then run around to the face and do lots of wonderful things. But that means that it is at risk here. Bell's palsy is a paralysis of the muscles of facial expression on one side. It's caused by, or most often probably caused by, inflammation of the facial nerve, by a virus probably, as it's passing into this bony canal. So it can't stretch anywhere, so it gets a little bit squashed. So the facial nerve gets squashed passing through this bony canal. So this part of the facial nerve is going to run to the muscles of facial expression. This means also that ear infections, infections of the mastoid air cells in here and that sort of thing, we worry a little bit about the effects of that on the facial nerve. But those are the foramina and canals linking the cranial cavity, and therefore linking the brain, a pretty important structure, with the rest of the body and what passes through them. And most of the time it's cranial nerves, but there are some important blood vessels in there. I mean, I didn't talk about everything. For example, foramen magnum, we also see the vertebral arteries passing through here, becoming the basilar artery and stuff like that. So there is a bit more detail, but those are the bony bits. If you learn those bony landmarks, you add them onto your knowledge of those other important structures, you know what you're talking about, right? Okay. There are more foramina of the face. So we'll do that another day. But there we go, cranial foramina. See you next week.